All right, so let's dive right into a scenario I think a lot of us can picture, right? Imagine the chaos of the emergency department doors swinging open and a team is rushing in alongside a gurney.
Oh, yeah.
You hear these urgent whispers like massive intracranial hemorrhage GCS of 4 pupils fixed and dilated. And, for anyone listening who maybe isn't familiar with the GCS, that's the Glasgow Coma Scale. And a score of 4 means we're talking about really, really deep unresponsiveness.
Yeah, that's right.
And in that moment, you realize, okay, this is serious. This is likely irreversible brain damage. And then the family arrives, faces just etched with fear and shock, and you find out they're devout Catholics. And in this incredibly intense situation, that I think our exploration of organ donation really begins.
And it is a really powerful scenario you've painted there because it throws us right into the middle of that difficult space where life and death and this possibility of giving life through loss all come together.
Yeah, absolutely. And I think that's why we're here today, right? In this deep dive, we really want to kind of unpack and understand the whole landscape of organ donation. We want to talk about what it actually means. Who can be a donor? How do you actually go about it? The challenges in getting consent from families. How do medical professionals even approach these conversations? And then ultimately, just the huge importance of this whole act.
Yeah.
We'll be using information on organ donation specifically here in the Philippines, looking at the laws and the cultural aspects that really come into play.
Right, because, understanding all of this is so important because organ donation is not just a medical procedure, it's a deeply human issue and one that's influenced by all these factors like the law and cultural norms and individual beliefs.
Okay, so first things first, the very basic question, what exactly is organ donation?
So in the simplest terms, organ donation is when a person voluntarily gives their organs or tissues to save or improve someone else's life. And there are a couple of main ways this happens.
So we're talking about living and deceased donation, right?
Exactly. So deceased donation, that's after someone is declared brain dead or they've experienced irreversible cardiac death. And here in the Philippines, that's all governed by the Organ Donation Act of 1991, which is Republic Acts.
Yeah.
No 7170. Living donation, on the other hand, that usually involves a kidney or part of the liver from a living person, and the Department of Health. They have guidelines from 2020 that spell out the details.
So we've got the legal framework in the Philippines. You mentioned RA 7170. Was there anything else that came after that to clarify things?
Yeah, there was a really crucial amendment that came later, Republic Act. NOS 9242, which was enacted in 2002. This one specifically outlined the medical and legal standards for determining brain death, which is, as we've said, a really critical point in the process of deceased donation.
Okay, so we've got the legal side of things, but what's the real impact? Why is organ donation such a huge deal?
Well, the statistics are pretty stark. Every year, over 10,000 Filipinos need organ transplants. But sadly, only a tiny fraction get them. We're talking about 1%. So that massive gap really underscores the urgency of raising awareness and encouraging more people to become donors.
That 1% is a pretty hard-hitting number. So let's talk about who can actually be a donor. First up, living donors. What are the rules there?
Right. So for someone to be a living donor, there are a few boxes they need to tick. They have to be at least 18 years old. They have to be in good overall health, and they need to give their informed consent freely. That's all laid out in RA 7170. Oh, and another important point, if the potential donor is a minor, parental consent is a must legally.
Got it. And what about deceased donors? Under what circumstances can someone become a deceased donor?
Deceased donors are individuals who've been declared brain dead according to those medical standards we talked about in RA 9242.
Yeah.
And importantly, there can't be any medical reasons why their organs couldn't be used. So things like active cancer that could be transmitted or uncontrolled infectious diseases.
Are there any specific conditions that would automatically rule someone out from being a donor, whether living or deceased?
Yes, there are some exclusions. And typically these include folks with transmissible diseases like HIV or hepatitis, or if they have ongoing sepsis that hasn't cleared up. The Department of Health's 2020 guidelines have a full list of these exclusions if anyone's interested.
All right, so we know what organ donation is and who can be a donor. Yeah. Now, let's say someone's listening and they're thinking, I want to do this. What are the practical steps involved?
Well, the most direct thing you can do is officially register as an organ donor. Here in the Philippines, you can do that through the Philippine Organ Donor Registry. They have a website, or you can register in person at the National Kidney and Transplant Institute, the NKTI.
So besides actually registering, is there any other legal documentation that's helpful to have?
Definitely. While registering your intent is key, having some extra documentation can really help make your wishes clear.
Right.
So things like carrying a donor card that clearly states your decision to donate, and you can also indicate you want to be a donor on your driver's license. That's in line with the DOH guidelines from 2020.
Now, this is where things get tricky, right? Because even if someone has registered and they have a donor card, the family still plays a huge role.
Absolutely. That's a really critical point.
Yeah.
Even if an individual has done everything right, registered, documented their wishes under the current law here in the Philippines, the deceased's family still has to give the final consent for donation to go ahead. And that brings us to a really big hurdle and a very sensitive area that we need to talk about.
Exactly. That leads us to that tough conversation about getting consent from the family, especially when a loved one has just been declared brain dead.
What are some of the main things medical professionals come up against when they're trying to have this conversation with grieving relatives?
This is where things get so complex, and emotions are understandably raw. There are a lot of deep-rooted things that make it difficult to get that consent. Cultural beliefs are a big one. In many Filipino cultures, there's a strong tradition of keeping the body whole after death, and worries about disfigurement and certain religious beliefs. These can create a lot of resistance to organ donation. Dr. Asis's research from 2016 really highlighted this. I can understand that. It's already devastating to lose someone and then to think about any changes to their body.
Exactly. And on top of that, there's often a real misunderstanding about what brain death actually means. Families might think it's the same as a coma, and that there's still a chance of recovery when medically there's no way the brain can function again. Dr. Paler's 2019 study touched on this common misconception, and it makes it really, really hard for families to accept that their loved one is actually gone.
And I imagine that in such an emotional time, other factors could influence their decisions too, right?
Oh, absolutely.
Oh.
Lack of trust in the healthcare system can be another big barrier. Some families might be suspicious about the brain death declaration. They might worry it was premature. As Dangelin wrote about this in 2013, there can be a fear that the medical team didn't do everything they could to save their loved one if they're already talking about donation.
And are there practical things like financial concerns that families bring up?
Yeah, financial worries, or rather the idea of financial burdens linked to donation, can be a factor. The National Kidney and Transplant Institute, their 2018 report, found that some families are concerned about the costs involved, even though the actual organ donation process is usually free for the donor's family.
So it sounds like even if the person who passed away had made their wishes clear, navigating these cultural beliefs, misunderstandings, and anxieties within a grieving family, that's a huge challenge.
It really is. And you have to remember the family-centric nature of Filipino society often means the family's decision is more important than the individual's prior wishes. So approaching this topic with grieving families requires incredible sensitivity and skill.
Okay, so for physicians and other healthcare professionals who are having these difficult conversations after a patient has been declared brain dead, what are some key strategies or approaches they can use to help families make this decision?
Well, empathy is absolutely key. As Dr. Jill Taco highlighted in her research back in 2017, healthcare professionals, they have to acknowledge and validate the family's grief and their loss before they even mention organ donation. Creating a safe and understanding space for their emotions is paramount.
Right. You can't just jump into talking about donation without recognizing the immense pain they're going through.
You're absolutely right. Once you've built that foundation of empathy and support, then it's vital to clearly explain what brain death actually means. Using simple language, avoiding all the complex medical jargon, and providing evidence like the results of an EEG or other tests that's all mandated by RA 9242. This helps families grasp that their loved one's condition is irreversible.
And would it be helpful to have other support staff involved in these conversations as well?
Absolutely. Transplant coordinators can be incredibly valuable. They're neutral third parties who are specifically trained to handle these delicate conversations. And as the Department of Health suggests in their 2020 guidelines, their expertise can help take some of the pressure off the family that they might feel when talking directly with the treating physician.
What about trying to reframe the idea of donation in a way that resonates with the family's values or beliefs?
That can be very powerful. For some families, emphasizing that organ donation can be a lasting legacy, a truly profound act of giving life away for the deceased's positive impact to continue, that can offer real comfort. Dr. Asis pointed that out in his 2016 work.
And considering how important faith is in the Philippines, how can religious or spiritual perspectives be included in these conversations?
Bringing in spiritual support is so important. The example of Father Manalo explaining the Catholic Church's support for organ donation, emphasizing it as a final act of charity and a way to honor the body, that really illustrates this beautifully. Having a chaplain or a religious leader who understands both the medical realities and the spiritual side of things can provide so much comfort and guidance for families.
So it's about finding that balance between compassionate communication, clear medical information and deep respect for the family's beliefs and values.
Exactly. It needs a multi-pronged approach that puts the family's emotional well-being first, while also sensitively exploring the potential to save lives through organ donation.
So zooming out a bit, what are some of the big steps that need to be taken to encourage more organ donation in the Philippines? We've talked about the challenges, but what are the ways forward to increase donation rates and save more lives?
Well, firstly, we need to be honest about where we are currently. The International Registry for Organ Donation and Transplantation, IRODT, reported that in 2020, the rate of organ transplantation in the Philippines was extremely low. Only about 0.05 patients per million population received a transplant. That really highlights how badly things need to change.
That's a huge difference compared to other countries. So what do we need to focus on to improve this?
Public education is absolutely key. We need big, widespread campaigns to explain what brain death is, to demystify the whole process, and to directly address those cultural beliefs and fears we talked about earlier. Collaboration is also essential. Engaging religious leaders, given their influence within communities, is vital, especially since major religions like the Catholic Church are generally supportive.
And building trust in the healthcare system seems fundamental too.
Absolutely. Ensuring transparent hospital protocols and having well-trained staff who can approach these sensitive situations with real empathy, that's all crucial for building and maintaining public trust. That's something the NKTI emphasized in their 2018 report.
Are there any changes to policies that could make a real difference in donation rates?
Exploring policy changes is definitely worth it. This could involve things like incentives for organ donation, maybe helping with funeral costs for donor families, and making the registration process simpler so it's easier for people to formally record their wishes.
So ultimately, it sounds like we need a fundamental shift in how society views organ donation.
You're right. We need a cultural change that truly values altruism and recognizes the immense impact of organ donation. That, along with all these systemic changes, is what we need to really increase the number of organ donors and ultimately save the lives of thousands of Filipinos every year.
It all comes back to that scene in the emergency department, doesn't it? The moment of profound loss for one family that could maybe become a moment of hope and new life for someone else.
Organ donation has that incredible power to turn tragedy into an amazing gift of life.
On that note, here's something for everyone listening to think about. In a paper by Dr. Pizarra, he explored the idea of an opt-out system for organ donation here in the Philippines. In the system, consent for donation is assumed unless someone specifically registers their refusal. Now, a system like that could potentially lead to way more organ donations, but it also raises some big ethical and cultural questions about individual choice and the role of the family in these really personal decisions. It makes you think about how we balance the urgent medical need for organs with those deep-seated personal and cultural values.
That's such a crucial point. While opt-out systems have been adopted in other countries and have had some success in boosting donation rates, the ethical and cultural implications need careful thought and open discussion, especially given the unique cultural context of the Philippines.
For anyone listening who wants to learn more about organ donation or is thinking about becoming a donor, we really encourage you to check out the Philippine Organ Donor Registry online at fellowdr.org or the website for the National Kidney and Transplant Institute, NKTI. They have loads of great information there, and you can also register to become a potential lifesaver.
Every single person who decides to become an organ donor has the power to make a real difference and offer someone in desperate need a second chance at life.
Couldn't agree more. It's such a powerful act of generosity and hope. Thanks for joining us for this deep dive. Until next time.
Take care.
Bye.